people. I am Waraga Bolkir, and this is Waraga Global Influence Podcast. By now, you already know this is not just any podcast, it's a movement. Here, we impact your lives, we educate your minds, and inspire your heart. It doesn't matter whether you are a student, a professional, or somebody that has aspiration. This is for you. Now, buckle up because again, this is yet another great episode where you're going to learn what it means to have a daily skincare. We will talk about hair loss, and with me today is a lead specialist of Refined Skin and Body Clinic, Dr. Kotecha, and he's here to give us impactful insights, things that you've been dying to hear, things that you want to know and are very good for you to know. Now, for those who have not subscribed, please, I would encourage for you to subscribe, share, so that it reaches to other people. Yeah, as you are also getting blessed. Yeah, let's get right into it. Hello, doctor.
Good morning. Hello, how are you?
I'm okay. How are you?
Good.
Yeah, good to have you back again.
Thank you.
I remember last time we tried to record one and it didn't work out.
Yes, well, that's sort of trial run.
Yeah, for some reason. I mean, Juba Power is something else.
Things are getting better, so let's see.
Yeah, I'm glad we could make it happen again. So before we dive right into more of a skincare and everything else that comes with it, who is Doctor? If you could describe yourself in 3 different words.
Okay, my name is Dr. CHIRAG Kotecha, as you said, lead specialist at Refined Skin and Body Care Center here in Juba. 3 words, hardworking, that's 2, hardworking.
And I can attest to that.
Adventurous, and yes, family man.
Family man. That I can also attest to.
Thank you.
Wow. So what was the drive? What was the drive? Why did you choose to be a specialist in the skincare?
Well,
What
my
was the
actual background,
inspiration?
I went to medical school and worked in the UK, in London, and other places in England. And then at that time, the field of aesthetics, so to speak, aesthetic or taking care of yourself, beauty, whatever, was in its infancy. It was growing. And those are one of the doctors I worked with was describing how it was nice to work with people who are willing to come see a doctor rather than having to see a doctor. Because part of my training was in accident and emergency. Actually, my background is A&E medicine. So dealing with sick people, death all the time, people who have heart attacks, strokes, whatever. And that was burning me out, was getting me tired. So I wanted to be with people who actually wanted to come see me improve themselves and yes, spend their own money without me having to ask them for it. So that was the drive. And then the business, so the industry kept growing. I kept studying more and more, and I was like, this is what it is for me. I didn't want to have the late nights, the weekend shifts that would come with emergency or A&E. And with this, I got time to spend with my family, grow the family, grow different aspects of my business. So I also run a hospital in Uganda. So different things. The drive was there, helping people improve their self-confidence, feel better, and look better, really.
And perform better.
Yes.
Wow, amazing. I mean, part of your job is you don't just help people look good, but you also do help them feel better.
Yes.
I remember when I came to the clinic, the first time I ever met you actually in Uganda was that I was looking for a solution. I had these pimples out of, of changing my regular lotion to a different ones, and I was like, no, this is not my skin. So I reached out to Refine. I came to the clinic, and that time it was formerly known as
yes.
Avani.
Yes,
It wasn't.
yes.
We haven't changed it to Refine, right? So I came and I remember walking into your office. By the time I was done seeing you, I already felt better, even before applying the creams and everything that you gave me that day. And that brings me to the question of, you're the cheerleader, you're a mirror. When people come to this mirror and don't like what they see about themselves, and then you are able to reflect it back now in a positive way as a doctor, I'm curious to know, how do you, deal with the emotional side of how people feel about themselves?
See, a lot of these, I don't call them patients or clients. These are relationships we form with people over time. It is not that I fix in one go. Like I said, Refine, we do 3 things. We make you look better, feel better, perform better. So when you're not looking you're 100%, you feel self-confident or underconfident, you're worried about how you look, it affects your psychology. So the first part is always the consultation. We understand what issues you face. We reflect. I mean, we're all human beings. I myself had a weight issue before.
True.
So I worked on that. My skin is always not always perfect. I go through up and down with skin or pimples. So we talk from what we've experienced or what I've experienced myself, what has helped other people, and we take them through this journey from the beginning. And we always say, look, I'm not here for you today, but I'm here for you for the long term. We'll work within what is within your budget, your time frame, what you expect. We set realistic expectations, use world-class services and skincare products that we can offer you to help really make you feel better. Once you feel you're looking better, your confidence improves.
Correct.
So for example, if you've got a weight issue, you're self-conscious about your weight. You're always thinking that people are judging you about how much you eat, what you look like.
Yeah.
So we start working on that, and we work as a holistic team. There's a medical practitioner, myself. We've got nurses on board. We've got nutritionists. We've got counselors or psychologists, especially in Uganda, who will take you through this journey, step by step, to help you feel better.
Yeah.
And remember one thing, like you described it when you first came in, using different skincare products, some will react to your skin. You might have spent a lot of money and you come in and that is not the right skincare product for you. So I encourage our listeners, always first do the consultation. You don't have to go and spend the money, buy the products immediately or follow the advice.
Yeah.
But the consultation is the first step. You might be using the wrong things. You've already wasted your money by the time you come in. So please don't do that. Come see us. We'll take you hand in hand through the journey.
Wow, amazing, amazing. Does the skincare really, what is the ideal skincare routine look like?
There is no ideal skincare routine, one and for all. First of all, the points I would like to say, consistency. If you've been prescribed a skincare routine, use it consistently if you want to see the results. Don't buy a set of skincare products and make it last for 1 year.
Yeah.
They're not meant to last that long. They're made for 2-3 months, like a supply at a time. So consistency, daily use, the correct amount. But in simple terms, you need to be washing or cleansing your face with a mild cleanser. If you don't have any skincare issues, if you have acne, then you need something with salicylic acid or benzoyl peroxide. If you have pigmentation, a different type of cleanser. So the first step is always cleansing. Then you can have a serum in the morning and at night, different serums, whether it's for anti-aging, sun protection, especially in Juba and South Sudan.
It's very hot.
Where the sun is very harsh. And then all our clients, sunscreen. Please make sure sunscreen is something you start using from an early age, because now we're living longer than our ancestors did. We're not taking our diet is not as healthy.
Yeah.
So apply sunscreen, please. Apply in the morning, apply in the afternoon if you can. If you wear makeup, wash it off before you go to bed. If you're in a dusty environment, using the bikes or bodas, wipe your face off after you've been in the dusty environment. And there is what you put on top, but there is also what you put inside. Drink lots of water, hydrate, and a diet full of green vegetables. Avoid the fried foods if you can. So you are a product of what you really want to portray outside. And obviously the bad things like stop smoking, alcohol consumption in moderation. So there's the lifestyle part, and then there's the skincare routine you should follow.
Wow, just for my viewers to understand. So Dr. Kotecha is a friend, a very dear friend. At first he was my specialist I went to help me get rid of the pimples that I came with. And then we moved from being a patient to friends.
Yes.
Then from being friends to business partners.
Yes.
And so that's how we brought Refine to Juba. But he has been in the field for quite a number of years, and it will interest you to know that he's the right person to go to. So if you are anywhere, you are in Uganda, you are in Rwanda, we are all there. Doctor has got you. And we have, quite a number of doctors, as he has mentioned earlier. If it's about your weight loss. So yeah, I'm very happy. I'm excited.
Thank you.
There's some of the things that I never got to ask you actually, and I am happy that I'm getting to ask you those questions.
By the way, let's go through
so that my viewers can also as well enjoy. So I recently did research. I mean, I'm having a conversation with a doctor, with the specialist for that matter, and the bar is high. I was like, oh, what right question should I even ask? So as I was going through the research, I found out that we usually lose, 1% of collagen, and especially for women, we even lose more, like 2% as we get older, which is a bit scary. Does that contribute to the aging? I
Yes,
mean,
so
talk to us about that.
aging has two things. To simply break it down, there's intrinsic aging, which you can't do anything about. That's from within, which is your genetics. We get older from 20 to 30 years old to 40 years old. You can't do much about it. Extrinsic aging happens due to our lifestyle, smoking habits, diet, etc., sun exposure, so applying sunscreen. So yes, collagen does decline with age over time, um, quite at a rapid rate. So there are sort of interventions to help improve the collagen. When we become older, we develop lines, whether it's dynamic lines from frown, like raising up the eyebrows, squinting. We lose volume in the face, and a lot of people come and complain about these laughter lines. The face looks older. So, firstly, is having a consistent skincare routine from a young age, from early 20s. Really, you should be starting to use good skincare products. Introducing what is called retinol or tretinoin, which is a US FDA approved anti-aging product. Very fantastic to help improve collagen. Then interventions, treatments from the doctor. Microneedling you can come in for, whether it's with your blood, very common platelet-rich plasma, or PRP, or using different serums to help the body's growth factors come and stimulate new collagen. We've got then further injectables, botulinum toxin or Botox injections, which are very popular, very safe. Actually, it's been around since 1978, Botox. We use it for frown lines, crow's feet,
wrinkles.
wrinkles. Then we use fillers, collagen fillers to volumize the face. Again, these are very safe if done in the right hands. Like I spend majority of my time training. You know how much I travel now, either in Dubai or Europe or South Africa or wherever it is, or the US as well. A lot of my training, I'm board certified in America. So we go there for training all the time to keep up with the skills, keep up with the trends. So there are different kind of things. So, I mean, really, the one interesting fact is recently, average age of somebody to use Botox injections for wrinkles now, the starting age is 27 years old.
Oh, really?
Because we're talking about prevention. You start with smaller doses, lower doses, you're preventing. We're trying to make you age appropriate. With the world growing in Botox, for example, just touching on Botox becoming so popular, by the time a 27-year-old now turns to 50, 60 years old in 20, 30 years' time, the wrinkles will be very minimal. So for her to be able to fit into that, her friends or cohort of people she's around, we recommend that Botox injections should be started now at a lower dose rather than waiting for the wrinkles. That's an example, just the Botox.
Wow. Amazing. I mean, let's talk about the food. I mean, eatable skin, right? They said no matter how many things that you've done to yourself, like the facelift, the brows lift, to the neck, and everything else, if you don't eat the right food, does that help in any way?
Food and diet is probably the most important thing. It's like, ask anybody who's going to the gym or trying to lose weight. There's the going to the gym, working out, but your diet has to be very, very important, if not the most important thing on the weight loss journey. Similarly for the skin, what do you eat? There's the antioxidants. What we have when we pass sort of urine and stool, which is a waste product of the body. When you breathe in and out, you pass out something called reactive oxygen species, so oxygen-free radicals, which is a waste product that comes out of our lungs. When these accumulate in the body, they give rise to premature aging, dull skin, etc. So if your diet is full of green vegetables, the spinach and whatever, these are high nutrients that help detoxify, cleanse the system, and then they give good skin. So that also brings us to our skincare. For example, we use glutathione. It's a very popular thing. People want for IV drips or glutathione tablets.
Exactly.
Why are you taking it? Now, at a low dose, glutathione is just going to help you detoxify. We all make glutathione in our body. At a low dose of glutathione, it's cleansing the system. But at higher doses, it starts giving you that skin benefit, the brightening, the glow. And eventually, if you keep very high doses, you can get a bit of skin lightening as well, which is safer than using those bleaching products available on the market. But so diet, glutathione. So if you want to come in for the IV drips, glutathione tablets, we have it all at Refined Body Care Center. Information is available on our website, refinedskinandbody.com. We've got Google, we've got AI these days, ChatGPT.
Yes.
All this information is available. We have these services. So the key is eat well, consistent skincare, come see the specialist, even if it's for a consultation, briefly. And I'm here once a month, and I'm also available remotely. So if you need a video consultation, you can come to the clinic, and we can offer that. Don't wait. Again, just going to the thing of acne. People say that acne has started, pimples have started in the teenage years or whenever it is.
Yeah.
They say it'll go away. Let me wait. Let me go to the supermarket and buy some, to the pharmacy and buy some creams. And here I see a lot of people being prescribed or being given steroid creams from the pharmacy.
Really?
And it gives rise to this lightening of the skin, uneven skin tone. They get something called steroid acne. Now taking them off that steroid cream is the hardest thing because acne will come back before we treat it properly. So please just make that initial investment. You have a problem, see the doctor. Don't just go to the pharmacy and buy your whatever cream you think is suitable. What you've seen on TikTok or Instagram might not be what is suitable for you. Social media treatments are not right for you. We have face analysis at our clinic. So right now we've been offering discounted or even free facial analysis once you pay for consultation at the clinic. So that is something you can take advantage of.
Wow. Yeah, doctor, I just love what you said. I mean, everyone should have a doctor, should do consultation because there's so many information out there. And if you don't have the right doctor to go to, not just any doctor actually, you should have a right doctor. Everyone should have Dr. Kotecha.
Thank you.
Yeah. So, doctor, I'm sure you've seen what is going on, especially in South Sudan, even across the continent. There are people that really have a damaged skin. What do we do about such people that have damaged skin from the skin bleaching?
First
can
of
it
all,
be restored
the skin
back?
bleaching, it can be. Stop using those bleaching products. You know, it's interesting. The fair people, the white people, want to become brown. They go darker, they go sunbathing.
I know, right?
And the darker people want to become lighter. It's really like, why are you not comfortable, firstly, with your, with your skin complexion?
Yeah.
Now, yes, if you've got uneven skin tone, sun damage that has happened over time, melasma, certain medications that you've been taking might cause darkening of the skin, that is understandable. We can treat that. Or if you've got pigmentation from your acne that might have occurred. But otherwise, really embrace your skin color.
Yeah.
Stop using those bleaching products. If you want to do the glow, I mean, there's a difference between glow and the bleach or the change of the color. If you want the skin glow, diet. Apply sunscreen. Come to us or come to any clinic that gives you safe and effective glutathione therapy, whether it is creams that we have here from this perfect range from California that comes in. We have glutathione injections, we have glutathione tablets, safe, effective treatment. So I get people coming to me and saying, look, my skin is damaged. I like calling them like zebra crossing because they're like different colors. And the first thing you tell them, look, this is going to take time. It could take months or even years. We've got different lasers we can use, chemical peels we use depending on the skin assessment. But the first thing will always be stop that bleaching product. Stop your bleaching cream. I'll get mostly thrown back and said, but now my friends will see me that I was dark or that's my skin color. I'm like, fine, if you want me to be your the treating doctor, you have to stop that. I cannot treat your skin, improve the quality of the skin. After those bleaching products, people, especially ladies, end up with stretch marks all over these big looking stretch marks. You can see the veins, uneven sort of what was called ochronosis, damaged skin. Very, very difficult to reverse. Very expensive also. So if you want to lighten or brighten up the skin, don't first use those bleaching products. They are cheap, they work very fast, but they damage your skin. And then coming off them, you'll not want to. So I've got a lady recently, I saw day before yesterday in my Kampala clinic who I've been treating for over a year. The first 6 months, she was recounting me. She's like, 6 months, she's like, doctor, I did not believe that we were going anywhere. I thought you were just taking my money, eating my money. Now she's like, I can see where we're getting at. My skin feels thicker, stronger. I am starting to brighten up. My friends are starting to appreciate that, yes, I'm not as light as I used to be, which was those sort of hydroquinone or mercury-based and jick. Sometimes they put jick even in there. In those mixed creams, I've heard of weird things.
Like the ordinary jick?
Yeah, I've heard of jick in there, mercury, which is illegal, steroids, hydroquinone at sort of unregulated concentrations, and it's illegal to have those kind of creams. I don't know how they get bypassed it. That is why I can't buy them packaged. Yes, we do use hydroquinone, which is a bleaching element for certain parts, but otherwise you should not be using that. So she was recounting that 6 months I didn't believe. She was doing IV vitamin drips, glutathione drips. She was taking the tablets. She was using the skincare products. We did chemical peels, hydrofacials, whatever it may be. And we slowly made progress. I told her, just be patient. So that's why I say, when you come see me, if your skin is damaged, it's a relationship. It's a long-term thing. It's not a magic throw. you'll have, and that's something our clients in South Sudan, I think
Yeah.
they want instant gratification. Please, now this is something targeted here.
Correct.
Clients on the weight loss journey and also on the skin journey here expect or want results within 1 week. We all do.
Overnight.
We all do. We all want that. The shortest time, the best. But the first thing is that, look, you may react to the skincare products I give you because these have active ingredients such as vitamin C, retinol, niacinamide. There's a variety of active ingredients in the skincare. So they may react to your skin for the first 1 or 2 weeks. Push through that. Do not feel that I'm reacting to this, I'm allergic. You could be. That's why you come and see us again. And then we continue the journey. But it is not overnight. In British saying, Rome wasn't built in a day. It takes time.
It's a journey.
It's a journey. So commit to that journey. You will see there's a light at the end of the tunnel. Consistency. So whether we prescribe you a treatment program at the clinic to come in for monthly hydrofacials or monthly chemical peels, for body contour, you got the fat freezing or M-Sculpt or whatever it may be. It requires consistent, repeated visits. Our manager tells us sometimes, like, oh, a client came and said she's not seeing results. I was like, how long has the patient been on treatment? 2 weeks. Really, I'm not. I wish I could make you improve your skin, get your acne rid of it in 2 weeks, your skin to glow, your pigmentation to disappear in 2 weeks. I wish I could do that. Anybody would do that. I think you'd probably be richer than Elon Musk then.
Yeah.
To do that, but it's not possible.
And one thing I love about what you do is that you're always transparent about everything. Like you would tell the patient, this is going to react like this. I remember when you gave me the first treatment when I had the pimples, you clearly told me what I would experience before I could see a result. That I should be patient. This is what it's going to do to my skin. It will, bring my skin will be rough. Like
didn't get darker because when we treat acne initially, especially in this part of the world, we notice that the skin gets a bit darker.
Yeah.
Because if you're not using enough sunscreen, for example. And here again, this is a very common mistake a lot of my clients make who come in. They're trying to treat the pimples and the spots, like the pigmentation or the black marks they've had from pimples at the same time. And the cycle gets worse because for our skin types, like what I'm treating, the darker skin types that I treat here, majority skin type 5 or 6, what I call the darker skin color, treating the pigmentation where we use vitamin C or other skincare products makes the acne worse. And some patients have either gone to another clinic or the so-called skin clinic or a beauty therapist and taken these products. Their skin is not improving, or they've bought it from the pharmacy. They might be on a vitamin C-based cleanser or vitamin C cream. At the same time, they're trying to treat the pimples, and it's just not going away. We have to treat it holistically. I look at it as a triangle for acne treatment. You've got the monthly treatment at the clinic, the chemical peel or hydrofacial or microneedling, whatever it may be. Then there's the home care routine. Then you may need some tablets. Sometimes it's antibiotics. Sometimes it's something stronger, isotretinoin tablets, which has its own issues, should not be taken without a prescription, very strong medication.
Correct.
And it's alarming how people just pick it up from the pharmacy and use this medication because the pharmacist or their friend was using it and it worked for them. Now they think it'll work for them.
Everyone's skin is different.
Skin is different. What their lifestyle is different. So we need to engage. Engage with the doctor.
Now let's come to Refine. Why should people come and see us?
Well, Refine, where I pride myself is that I've been doing this for over 15 years now, if not more. I train constantly, or I make sure even my team is trained constantly. We always innovate, so we buy the latest technology, latest skincare products.
Correct.
We invest in our training. That's the main thing. So we know what we're giving you is tried, tested, internationally recognized skincare products. We have a variety. So yes, cost being a factor, we've got levels of skincare products that come from basic or affordable to the more premium and expensive ones. We have a variety of them. Refine, we are in Juba, we are available at Sadeco building on Airport Road.
First floor.
Yes, Airport Road. Please come in, nice clinic. Team is always there Monday to Saturday. I'm available here once a month. I do come to Juba, or could be even twice a month. Sometimes twice a month. I'm available remotely, as in on the computer or the Zoom call or whatever it may be, for your consultation. So Refine for Juba, South Sudan is the first of its kind, I believe. I don't know if there was another skin clinic before. I think some are coming up now. Some are coming up now. So we are offering you these world-class treatments in your backyard, in the local vicinity. Like I said, consistency and regular visits. So previously you might have had to travel to Dubai, Turkey, wherever it is for these treatments. Now you're going to be traveling every month. That also gets
Which is expensive.
Correct. So if you've got it locally available, these services and treatments are there. And we are ready to listen to you. If there's something that you feel you've seen outside, something of interest, and you want us to try offer it to you here, we can look into it. And obviously we'll not just buy any machine. We want to try buy the best that we can, that we can afford to buy.
Yeah.
Obviously there's certain things that are way more expensive, but we invest in ourselves to be able to give you the best. That's how I feel.
Correct. One thing I know is for sure is that you don't just spend a month without traveling and get updated.
Yes, I'm always.
You get updated. I mean, you invest in your most of the time. You go to Dubai. You go to
2025 this year. I've been to Dubai twice for training. Third time will be next week.
Yeah.
I've been to South Africa where I was training other doctors. I was being trained to train other doctors and injectables. So I'm the trainer.
Trainer of the trainers, TOT.
Yes. I've been trained to teach other doctors, which we started classes on. So if you've got doctors interested to learn some of the services we do, we believe the more people we teach, the more people we can impact.
Correct.
So I cannot manage to see all the thousands of people.
Yeah.
So we want to teach other people so they can help this other people as well, other patients. I've been to Europe a couple of times for training. Again, one was for liposuction, one was for some advanced laser treatments. I went to the US for training.
Yeah,
that's just this 1 year. That's this 1 year.
Yeah.
So I'm in and out a lot.
I remember there was one time you like, do you want to join the training? I was just imagining myself, what will I be doing with the nurses and the doctors? I will just be confused when they talk about a product or something.
So sometimes we're allowed to bring in non-medical personnel to be the models. So for example, when we do go for training, we also need to practice hands-on, do our services on somebody.
Count me in next time.
Sometimes they give the offer, yes. Well, like next course I'm planning to go on in the new year is for hair transplant.
Yeah.
Not that you have a hair issue, but yes, we're going to be offering hair transplantation. We do offer hair restoration treatments right now using microneedling. We got skincare products, the hair loss shampoos, conditioners, minoxidil. But some people do require minoxidil. For our ladies listening, big common problem I see here is something called traction alopecia. A lot of plaiting and braiding leads to hair loss from the front.
Yeah.
So sort of wear your hair in cycles. If you're wearing it plaited or braided for 1 or 2 months, next cycle, keep it natural. Let those hair roots strengthen up. Now again, clients tell me that, but taking care of my hair, if I wash it, becomes an afro. I need it. Now that is something personal. I can't help with that.
Exactly.
But keep it short for that time being. Otherwise, in the long term, you will end up with bald patches.
Yeah. And I just love what you say. I think is embracing what you have. Authenticity is very important. This is what God has given us. So we just have to find means and ways on how to maintain it. And one thing that I've observed here is that people go to the salon, they remove what they are plaited and they undo or unplaited and plait again. That does not allow the hair to actually, it can break.
Correct. It can break. It can lead to, a lot of people have this issue called, what we call in medical terms, seborrheic dermatitis. You might call it dandruff or that flaky skin.
Yeah, the dandruff.
That is going to eat up that hair that is trying to grow. So we need to treat that with antifungal shampoos. So ladies, please give your hair that break, that cycle.
Yeah.
Try not to always use chemicals. Give it some natural time, yeah. And then if you do require interventions, come in, use biotin-based shampoos, hair loss shampoos, conditioners, lotions that we have. These are safe, not costly.
Yeah, they're not.
Some of these products like the shampoo conditioner will cost you, I don't know what, $20, $30 if that's the cost. And that's what you require for hair. You don't need anything too expensive.
Thank you. Maybe you can talk more about the products that we have right here that we offer.
Right now, I've got a sample of a few. In front of us here, we've got the Perfect Skincare range. This blue and white one comes from Beverly Hills, California. That we have this is the glutathione thing I was talking about.
Yes.
For skin brightening, softening up the
Glowing.
skin. For the face, if you want a basic good skincare routine, there's peptide moisturizer, which helps with anti-aging. You've got retinol, skincare brightening products. So this is all the Perfect range here. Suitable for all skin types. But we also use it for problematic skin in different combinations.
Yeah.
Again, if I prescribe you something, your friend or your sister might require a different routine. So please don't, might suit her, but it might not.
What works for me might not works for you.
Then here we have our hair loss shampoo and conditioner. We have other brands as well, but this can help. So it's daily nourishment protection for split ends, different products, different technology to help
Yeah.
improve the quality of the skin. This baby foot is actually quite a fantastic product of mine. This is to soften up your feet, cracked feet, heels and
Wow.
whatever. So this is something you wear. It's sort of plastic socks that you wear and helps. It's a chemical peel to improve the quality of the skin, of the feet. What do we have here? This is glutathione tablets we talked about for anti-aging, for skin brightening. So here it says skin whitening contains high level of DHA that stimulates the body's production of alpha lipoic acid and collagen. Converts glucose into energy and helps body to eliminate harmful substances. Like I said, it helps cleanse the inside of the body.
Yeah.
It helps the effect of anti-aging, repairs dry skin to make it smooth and supple. So there's multiple ingredients in here that's active. I've had this for some time. This is a hair growth enhancer. So when you treat your hair, if you're losing hair, whether it is hormonal or traction alopecia with different issues,
Yeah.
you can apply this solution in the morning. It increases the blood flow to the scalp. So think of it, if you're planting a seed, which is you're trying to grow your hair, and if you're not feeding it, whether it's with the good nutrients or with the hair growth enhancers, like if you're not putting water into that seed, it's not going to grow. So this is like applying those growth that help the root grow.
Yeah.
Then this is again part of our skin brightening range, crystal tomato. This is very beneficial for people who've got uneven or blotchy skin, who don't want to lighten per se,
Yeah.
but this one preferentially targets those darker patches. And it has to be used for a minimum of 6 months. So again, one packet is not going to be enough. Consistency. Like this is again for hair loss. So today we've got hair loss products, but we do have treatment products which we normally bring. And you can come see them at the clinic for wrinkles treatment, volumizers.
Yeah.
We offer weight loss solutions, which is very common, very popular in the world. Ozempic, Mounjaro. These are weight loss injections that are taken once a week if you don't want to go for surgery or an operation. We have these available at our center at Sadeco building. But key note is that these medications do have some side effects, so not suitable for all people. Hence, it's important to come in for a consultation, understand the risks, have your blood tests done, and then come in for a weekly injection where our nurse is fantastic. She's been trained
Yeah.
on how to administer this medication, at what dose, and we sort of build up the dosing as you require, as you achieve your target. But again, everything goes back to your basics. Good diet, good nutrition, exercise, if you can, drink lots of water, avoid smoking, and consistent skincare routine or a weight loss management, whatever it may be. So if you want to look better, feel better, and perform better, please do come to us.
Come to Refined Skin and Body Care
And
Center.
we do treatments for sexual dysfunction also. I mean, statistically here, a lot of, as men get older, we have issues with impotence, maintaining erections, etc. So we have treatment options for that without having to resort to things like Viagra or tablets. We can do PRP treatments. Again, the thing is, what I call myself, we're a functional medicine specialist. Functional medicine. So we want you to function better, look better, feel better, perform better.
Perform better. Yeah, I love that. I guess it's one of our topic that we will touch and talk about more next time, because people need to understand that it's not a shame to go seek for medical attention in the areas that you need.
It affects them psychologically. It can affect
Yeah.
men and women psychologically. So rather
Yeah.
than
Sexual health, I think,
Sexual
is
health,
very,
rather
it's very
than sort of-
important. Because
rather
it
than
can save your marriage, it can
Correct.
save your relationship.
Psychology as
There's
well.
nothing wrong in coming to doctor and
it's all confidential. Come and seek the discussion, what options we have. Like you said, it'll help your marriage, help you feel better. You might not be as angry because you're
Yeah.
suppressing all these feelings.
yeah.
So they can help. The women who've had multiple children, who have issues with urinary incontinence, when they cough, sneeze, they get a bit of urine leaking.
Yeah.
We can treat that as well.
Correct. When people come to your office, and I guess, let me just say women, what do they come most in for you for?
Variety. I mean, okay, like yesterday I was here. My yesterday was filled with treatments for wrinkles and anti-aging, so wrinkles on the forehead, down here. Acne, a lot of acne or skin damaged issues. Weight loss.
Yeah.
So we say the top 3 treatments would be on the skin side, let's talk about skin first, would be acne or pigmentation, followed by skin brightening. They want to improve the skin glow.
Yes, skin glow.
We had a couple of hair loss queries. It's variety. It's a mixed basket. We treat one problem can lead to another problem. Weight has become a big thing, especially recently.
Yeah.
And I know it's big coming January. At the beginning of the year, people make New Year's resolution.
Yeah.
Want to start the gym, spend a lot of money there. But we can help you on that journey too, on the weight loss journey. So hair loss, weight loss, hair removal. Yes, I don't know not so much in South Sudan, but we do have laser hair removal services. If you're tired of shaving or waxing your underarms and bikini, you can come and have that lasered off. Very safe, no chance of cancer. That's the biggest question I get. Will this not cause me cancer? No. These have been investigated, tested properly. There's studies on them. So laser hair removal is very safe, provided done properly. So our therapists can give you those treatments there. It's hard to say which one or the other. Well, it changes. It really changes. It's seasonal.
Yeah, it's seasonal for sure. And women, can you tell a woman if she's in perimenopause just by looking at her skin? Because sometimes it's another thing as well, especially with hormonal changes. It's a bit of a roller coaster for women with ups and downs in moods. Can you tell if a woman is in perimenopause?
We can somewhat, because the skin gets drier, first of all. It's difficult to say just from looking at them that they're perimenopausal. Normally, part of the consultation, they'll come and say that, my skin feels a lot drier, I'm irritable, I'm putting on weight. Now, when they start saying those three things, I'm like, okay, need to do some kind of hormonal analysis, because the first hormone that will decline in women is progesterone, and usually also testosterone. Women have testosterone also, which helps with mental clarity. So they'll come and say, doctor, my skin feels dry, I'm putting on weight, I'm forgetful. Now, those are all triggers for you to investigate for hormone deficiency. Because you can treat those issues, but if you don't treat the underlying hormonal imbalance, it's difficult to manage the sort of 360 of the patient. So we'll do a hormone test and treat you with hormonal creams, bioidentical hormonal creams. So there is HRT or hormone replacement therapy, which is done by gynecologists. A functional medicine specialist like myself will do what is called bioidentical hormone replacement therapy, which is cream or patch-based treatment of hormones made from plants. They mimic your natural hormones, plant-based, natural hormones. Now we'll supplement either your progesterone, which will help you now sleep better, will help you sort of lose that retained water, because lack of progesterone, your body starts retaining water. Estrogen, if you've got dryness, whether it is in the face or vagina, whatever, this estrogen supplements come in. Testosterone for again, mental clarity, but different combinations for different patients. It's not one size fits all.
Yeah, thank you for that. Have you seen what is happening here? People take a lot of sugar. Does sugar cause deformation in the collagen?
Sugar will lead to, I would say, insulin resistance. Insulin resistance in itself, this whole cycle that end up leading to delayed recovery from wounds or skin healing. So yes, they can lead to degradation in collagen, but you do need a certain amount of sugar. These sugar, what are called glycosaminoglycans, which in the skin, do require a certain, it's a sugar. So you require that, but rather than taking artificial sugars, you've got natural sugars in fruits, and I like seeing that everybody eats a lot of fruit here. That is good. But yeah, the lack of excessive sugar has its weight issues. So there's many things that comes with excessive sugar.
For those who have never really gone through skincare, for the beginner, what do they need to begin with?
Beginners, simple cleansing. So don't use soap. A lot of people say, what do I use on my face? Soap. I use Dove soap. This is fine. It's good for the body.
Yeah.
Not for the face. Sometimes it's too harsh for the body, for the face. It can lead to excessive dryness, for example, which can lead to excessive wrinkles formation. So start with a mild cleanser if you can. Anything for the face. Lots of good brands out there. You can buy this either from a specialist, pharmacy, or supermarket. Simple cleansing and sunscreen. Cleanse, hydrate. So moisturize. Vaseline is a very good moisturizer. Vaseline petroleum jelly is actually very non-comedogenic, but it cannot cause acne. It will hydrate the skin well. So you wash, apply the Vaseline if you can, and the sunscreen. Definitely a sunscreen. Away from the oils, especially if you've got acne-prone skin. I get patients coming in and saying that I've been applying coconut oil to my face or this oil to my face. Fine, but then at some point it will start clogging up your pores and give you acne if you're acne-prone skin.
Wow. Speaking of acne, what really causes acne, and how do we like maybe reduce the cause of that?
Acne can the majority of the reason is because something called Propionibacterium acnes, which is a bacteria. So if you've got something, sebaceous gland sitting under the skin, sebaceous glands remove oil or sebum. That sebum oil comes onto the skin, and it's a very good juicy environment for this bacteria to come and start multiplying and giving you pimples. So when you get that, you get clogging of the pores, get blackheads, whiteheads, these all parts, sort of hallmarks of acne. You come in, we treat it with antibiotics to kill the bacteria, reduce the oil, so we dry the skin using salicylic acid or benzoyl peroxide. But the bottom thing is due to excessive production of sebum or oil, which can be hormone related. So you'll say, women will say, when I'm coming to my periods, I get more pimples. That is because the more sebum is coming. When I'm stressed, I get more pimples because the oil, the sebaceous glands release more oil when you're stressed. This is all part of it. So when we're managing somebody's acne, that is part of the medical treatment, but it is also understanding what is possible. I cannot stop you from ovulating. I can't stop you from having your periods. So when you're coming to your periods, you might get a few more pimples with or without treatment. But with treatment, at least the damage that it's causing, the pigmentation or scarring is reduced.
Amazing, amazing. I always hear this black don't crack, but it's not true. I mean,
We're aging more.
Sunscreen is very important.
And the sun
And
is
I love the
harsh.
sunscreens we have.
Yes,
We have the
any
best
other-
sunscreen.
Yes, amazing.
I mean,
So-
it doesn't leave any white patches or something.
So there are different types of sunscreen, but because our majority of our patients have very dark skin here, they require the clear. So we've got clear sprays. We've got clear creams also. They're very light. They don't make you feel hot and sweaty in this Juba heat.
Yes.
And they don't clog the pores, and they don't leave that white cast on you.
That's true. I mean, people can attest to your skin and my skin. Yeah, that tells you that Refine has all that you need.
Yes.
If you are a beginner, you've been in a skincare, or you're just there confused, don't know the right products to buy and put in your skin, don't get confused anymore. Just come to Refine Skin and Body Care Center, Juba. We are located in Sadeko Building, Airport Road. Come and see the doctor. He's there for you, and he will be waiting for you with our team of expertise that are always, being trained. And like people will ask, why should people come to Refine? I think he has already explained that our doctor always keep himself updated. There is no skincare that is trending that we don't have in our clinic. So maybe doctor, as we get to the end, you perhaps tell us about what are the most maybe 2 or 3 top skincare, trending and beauty treatments out there right now.
Right now, a lot of people talk about the Korean glass skin, snail mucin, whether it works or not, but this is all hydrating the skin. So Korea, I believe, is a very good center for skin innovations and treatments. But the trending thing right now, we have something called polynucleotides. PDR and Kim Kardashian made it famous. The salmon sperm facial or something, I don't know if you might have heard, salmon sperm made out of fish. These are growth factors that can be injected into the skin or microneedles. So that is a very, very big area which I use also to help stimulate collagen, to help improve fine lines, to help pigmentation. So those are called polynucleotides. There's something called exosomes. Exosomes, again, are growth factors or stimulate. They help recruit growth factors in the body. So this is an area under research, constantly developing, that is there. So exosomes, polynucleotides, things that never go out of fashion are things like Botox, microneedling with PRP. These have all been there. And I will say one thing that should never go out of trend, the one key major takeaway, sunscreen. Just use your sunscreen. I don't know how much I can insist on that one. So that's something that should never go out of trend. So I would say that.
Amazing. Now, one last advice to the viewers, generally about the well-being in the skincare.
Well-being, 1, fix the problem before it gets too late. So come and see the specialist or seek guidance before the damage gets irreversible or very expensive to reverse, and prevention is better than cure.
Cure. Yeah.
So, good diet, avoid smoking, drink lots of water, apply your sunscreen, and eat lots of green vegetables.
Eats a lot of vegetables. I'm going to eat one right now.
Green vegetables, yes.
Yeah. Thank you very much. Thank you for giving us your here. I mean, we are here for you. Yeah, we will bring in a lot of contents that will benefit you. But please, we cannot do this alone. Subscribe, share, and, share it with your family, share it with your friends so that other people get blessed as well. And see you next time. Bye.